We're going to dive right into the conversations as I'm joined by Sarah Farwell, who is the Vice President, Strategy, Communications and Public Affairs with the Waterloo Regional Health Network, and hands down the smartest Farwell to ever be on this show. Good morning.
Good morning, and I debate that.
Well, we could have that debate over a family dinner sometime, perhaps. Sarah, let's talk about this merger that the Ministry of Health approved back on April the 1st. Grand River Hospital and St. Mary's Hospital come together and are now the Waterloo Regional Health Network, or RHN. What does this merger mean for access to care in our community?
We are so excited and so proud to be here together on our first RedDAY as RHN, and thank you for always providing us that support, Mike, and getting our news out to the community. Really, the why for the merger was our community and was our patients. We knew that if we combined our resources, we combined our expertise, that we could better serve the patients in our community. We actually built this merger on 90 years of partnership. We have been working together for decades. And we heard, as we plan to build the new hospital, from our community, from our team, that actually that partnership is so important in the delivery of better coordinated, high quality care. And so we knew that merging was the right thing, and we did that about 2 months ago. What it means for patients today in terms of accessing care is continue to access care where you did before. The sites may have new names, but the services that are at each of them are as they were. So formerly Grand River KW campus is now run at Midtown. That's where you would go for cancer care, for stroke care, for childbirth. Run at Queens Boulevard, which was formerly St. Mary's, is where you would go for cardiac care. Run at Chicopee is formerly the Grand River Freeport campus. So in terms of access to care, please continue to go and access care where you did previously. Our emergency departments are both still open at Midtown and at Queens Boulevard.
Why, Sarah, is this milestone important for the region?
So this region is so incredible. We have incredible growth happening. We actually are growing at twice the provincial average. The hospital and our regional programs actually serve 10% of the province's population. So our regional programs like cardiac and cancer see patients come from the Grey Bruce area, from the Stratford area. And so we really need to be able to plan for those services and advocate for those services as one. Also, coming together as one network allows us to attract new resources, new talent to the region to work in this single healthcare network. The two organizations that came together, the Legacy St. Mary's, had a 100-year history in this community. Grand River had a 135-year history. And now coming together as one unified organization, we're able to better serve the community. What does the hospital now set its sights on? You know what, the possibilities and the opportunities are vast. This year, our focus is largely on three main priorities. That is on continuing our merger success. So we've legally come together as one organization. Now we're bringing together people, processes, tools to better serve our community. So that's our first priority. Our second is continuing on our redevelopment project. So building the new hospital and redeveloping our other sites as well. And I wanted to take a moment to thank the provincial government and MPP Harris. We just received a $10 million planning grant to be able to continue that work. And we're very grateful to be able to do that so we can open a new hospital for our community. We're much in need of that. And then our third and probably most important priority is continuing to deliver high quality care, clinical care to our community. There are some needs here that we aren't able to offer locally, like neurosurgery. And so we're working with our government partners, working with our health system partners to bring new services and new programs to this area. And so that's our third priority this year.
You talked earlier, Sarah, about those emergency departments remaining open for patients continuing to access the care at the buildings, the sites they were accessing care before. They just have some different names to them now. And as RHN, there is a renovation and repurposing of a couple of the existing sites, Midtown KW and Chicopee, Freeport. Also, RHN will be maintaining the St. Mary's Hospital or RHN at Queens Boulevard. So until all of these services are transitioned to the new acute care hospital, which will be in North Waterloo, as well as the Midtown site, what growth opportunities might emerge here?
So we are always looking for ways to better serve the community. We do continuously look for where the needs are. We collect data on our patients. We work with our health system partners in our Ontario Health team to understand, as we become more diverse here in the region, what are the needs for different programs and services. So I spoke before about neurosurgery, and that is something that we'd like to bring to the region. We want to continue to increase our beds. As we move up to that new hospital site, we do look to expand capacity. And then I think there's some neat partnership opportunities with partners here locally, the universities, our innovation ecosystem, in terms of, how do we transform healthcare so that not everything needs to be offered in a hospital as it is now. There's lots of innovative ways to deliver care out in the community, to partner with both public and private entities to deliver care differently. And so, the ability to use data differently to understand that, innovation, research, there's lots of opportunity for growth in those sort of non-traditional healthcare areas that will allow us to deliver care differently and better for our community.
We're moving here. This feels like there's excitement attached to this, and no shortage of work for you. Yeah. One of us Farwells has got to work. Sarah, thanks for being here this morning.
Thank you, Mike.
Sarah Farwell joins us on the show, Vice President, Strategy, Communications and Public Affairs with the Waterloo Regional Health Network, or RHN. We are on location in the Uptown Waterloo Public Square for RedDAY here on the Mike Farwell Show. 570 News Radio and Rogers TV. RedDAY. We're celebrating the healthcare in our community. And we are joined now by Jamie Wilson, who's the Vice President of Development with the Waterloo Regional Health Network Foundation, RHN Foundation. Jamie, good morning.
Good morning, Mike.
And Ashley Howitt is with us as well, VP Strategic Initiatives with the RHN Foundation. Ashley, good to see you as well. Good morning.
Good to see you.
Ashley, let me start with you because hospital foundations are an important partner in healthcare. I think we all understand that. But can you give us an understanding of the role of a foundation in helping to elevate healthcare in our community?
Absolutely. The foundations exist purely to support the hospital with the purchase and funding for things like equipment, programs, things that the government doesn't fund. So what the foundation does is the foundation is actually responsible for funding programs, equipment, things that the government doesn't actually come to the table with. So the government does a lot of great things, funds operational activities, the people, and what we do is we're there for all the equipment. So MRIs, PET CTs, anything that you would, even furnishings of the hospital. That's what the foundation does.
Hey, Jamie, why are community donations essential for the hospital to deliver patient care?
Yes, so Ashley already touched on it. The government does fundamentally fund our operations. But outside of that, it's really up to the community to put equipment in the hands of our healthcare workers, our frontline workers, and also in some cases build out programs that, make a difference in our community from a healthcare perspective. I think fundamentally, it's the community that really moves the needle for these folks inside the walls of all three locations of the Waterloo Regional Health Network. So thanks to the community.
You talk about those three locations, and we talked about this earlier with Sarah when it comes to the hospitals themselves merging. And with the hospital merger, we also have the foundation mergers, right? So Grand River and St. Mary's Foundations have now come together to form the Waterloo Regional Health Network Foundation, which is the now unified philanthropic organization that supports RHN. Why take this step, Jamie?
Well, there's been a long history of both legacy hospitals working together. For example, we had 700 jointly credentialed physicians working at both legacy hospitals. And what that means is, oftentimes and you would know this from yourself or even a close family member or friend, sometimes you may have a heart condition, but also maybe battling cancer, unfortunately. So coming together really allows us to have that continuum of care where we can treat a patient, a community member, within the same health network. And what that allows the foundation to do is to reach those community members and donors that maybe have an affiliation to not just the cardiac center, for example. So it allows us to inspire and educate our community in a more focused and fulsome way.
Ashley, what does this mean for donors?
So for donors, what it means with us coming together is that you've got one spot to go to donate. I think there's a lot of rich history of the foundations working together in different campaigns. And what we see from donors in the community is that it's always more successful. People loved giving to us when we were together. They loved knowing that we were working together for a cause, and I think it goes all the way back to, I have lots of donors refer to OVOV, which was a campaign early 2000s, One Voice, One Vision. It was wildly successful because the hospitals and the foundations came together. And so we did a little bit of something together, Jamie and I, in our time with bringing MRIs to this region. So, I think that what it means for donors is that you can have one place to go, and you've got one service, and you've got Jamie and I working hard to make sure that we're here for you. So.
Jamie, what role does the RHN Foundation play in realizing this bigger, more ambitious plan for healthcare in Waterloo Region?
So, thanks, Mike. I think this is important. I think it's important to remember that it's exciting what we have in front of us. This new hospital build, potentially the second largest in our province. And that is exciting. The innovation we can bring to it, the healthcare advances. But there are needs today, and that will continue to be there as we build that new location. We are here to continue to inspire the community to donate now, but to also think about the future of healthcare in our region and what that means to them. So, I think of the foundation as not just an avenue in which to contribute, but an avenue in which we can inspire, we can demonstrate impact, and we can be a hub for community members that just want to know how they can contribute and get involved.
When you think about the future of healthcare in this community, what do you think about? This feels like such an exciting time.
It is. I just got goosebumps when you asked that question. I think this is a historical moment. And I am so excited for, my friends, my neighbors, my colleagues, for you, Mike, and your family to have access to world-class care. This community definitely deserves it. And, from my time working with the foundation, we are definitely very grateful to have such loyal donors in our community that really value healthcare and what it brings to our community, not just from a social perspective, from an economic perspective and more. My mom always said this. She has passed, but she always said, if you don't have your health, you don't have anything. And I really believe that's true.
Smart woman. Jamie, thanks so much for being here today, and we're looking forward to the road ahead. It's a busy one for you, I know, but we're really looking forward to this. Thanks
you so much, Mike.
Jamie Wilson joining us, Vice President Development with the Waterloo Regional Health Network Foundation, and Ashley Howitt here as well, Vice President Strategic Initiatives at the RHN Foundation. We are on location today in the Uptown Waterloo Public Square. It is RedDAY, and we celebrate it on the Mike Farwell Show this morning. 570 News Radio and Rogers TV. Site redday.ca. I'll get to that again in just a moment. But while we are on location here, yep, there goes one of our ambulances by in Uptown Waterloo. We are located today in the public square in Uptown Waterloo. And, I've often said, you never know what you're going to get when you open the phone lines on a talk radio show. You never really know what you're going to get these days when you're on location either, because before the show started, a very nice gentleman came by and wondered if we as a station were a clone of the Canadian Broadcasting Corporation, the Mother Corp itself. I said, no, we're not a clone. So he says, so then you tell the truth. Listen, this whole mistrust and distrust is getting a little tired. I promise you, I will only ever tell you the truth and nothing but the truth. So help me God. While I'm here in Waterloo today on location, it would be appropriate to send a huge thanks to Mike Pereira and the team at the Research and Technology Park up by the University of Waterloo. We were out there yesterday afternoon, and to those of you who made it by for a drink and a bite to eat, as we celebrated a very busy month of Farwell for Hire fundraising. It was a great way to spend an afternoon. The weather was reasonable enough, a little bit of rain early, but cleared up nicely. We had a great day, raised lots more money, and what a way to do it, right? Have a beer, eat some tacos, socialize. It was a great afternoon, and Mike and the team at the R&T Park made it happen. So we are very grateful to them for that. I mentioned a moment ago, oh, by the way, don't forget, sorry, but one more thing. June 15th, okay? Mark it down, please. Sunday, Father's Day, June the 15th. We're going to be at Barry's Asparagus with the Schmuck truck there for our deep fried asparagus day fundraiser. It's always a great day, and that'll put a bow on our 2025 Farwell for Hire campaign. So please join us on Father's Day out at Barry's Asparagus. Beautiful spot, terrific food, and a little bit more fundraising. The RedDAY.ca website I mentioned earlier is a site we encourage you to visit today, because when you donate, you are doubling your impact with Manulife, matching donations to our Waterloo Regional Health Network up to $200,000. And just to put it in perspective, a little bit of what RedDAY and Manulife and its support has been able to do over the years. In 2024, a new program called Prevent was started with investment from Manulife, and this Prevent program helps people at risk of heart disease by tailoring treatment plans that can mitigate that risk, including helping patients stop smoking, improving diet and exercise, and managing other health issues that could lead to heart disease. It is what its name implies, the Prevent program. You may have seen some of the posts on social media with our good friend, the Codfather, Ron Caudle, was involved in that and helping to promote the Prevent program and show just how easy it is to take those steps and help to mitigate the risk of heart disease. We are on location today at the Uptown Waterloo Public Square for RedDAY, and our conversations continue this morning on the Mike Farwell Show, 570 News Radio and Rogers TV. And thank you very much for joining us and being a part of our special RedDAY broadcast today on location in the Uptown Waterloo Public Square. Really pleased to have across the table from me now Jessica Wilson, who's a registered nurse with the Waterloo Regional Health Network, or RHN. Jessica, great to have you here. Good morning.
Good morning. Scano. Nyawagoa. Deo Sare Nigaso, Otahioni Nigawashauta, Gaya Kono Neo Quensodan, Oshwigandakwateno. I just spoke a little Cayuga that I got to learn as I was growing up, and basically I just gave my Ongo Homeway name, which is Deo Sare Shiny Bright Leaf, and I'm part of the Cayuga Nation Wolf Clan. I grew up on Six Nations of the Grand River Territory, so about an hour from here, from Waterloo. That's where most of my family resides as well. I came out here for school with Conestoga College / McMaster University for that Bachelor of Science in Nursing, and I've been at RHN since, well, during school and then post-graduation as well. I've worked in the emergency department, and now I work in the intensive care unit at Midtown campus as well. And I got to go back at Conestoga as a professor, teaching Indigenous health and history to future nurses, so nursing students. And now I'm a student again as well. I'm doing my master's at University of Waterloo, so it's a great time. And thank you for having me today, Mike.
It's a real pleasure. Tell us how you got into healthcare. What started you on this journey?
I think I've always wanted to do something in health. I've always been doing surgery on my pets, or stuff, not my pets, but my stuffed animals. And my nana was a nurse. She worked at the General in Hamilton, and then she did a lot of I guess it would be transfers, like Madison up in Akwesasne. And then in the later part of her career, she was actually a nurse at Iroquois Lodge, which is on Six Nations, where she eventually became a resident afterwards, and that's where she passed. So that place holds a special place in my heart. But she would take me on her night shifts, and as she was doing her rounds, I was in a jerry chair, so she would just push me. And the residents loved to have a young person there, but also I just got to see. So technically, I think I've been a nurse since I don't know, probably since I was a child, doing rounds since with my nana. So that's kind of how I got started in healthcare. And now I'm really focusing on like Indigenous health and really addressing those disparities as I go through my career. So it's been really a whirlwind, really. Yeah.
I'd like to explore that a little bit further. The statistics that are worse when it comes to Indigenous health. And look, it is the month of June. That is National Indigenous History Month. So why, Jessica, are those statistics worse for Indigenous people? Is there any level of distrust, perhaps, associated with this?
For sure. And truthfully, in short, it's a direct result from colonization. Like if you look at places like reservations where we were forced to be relocated because of the Indian Act, they're food deserts. The closest place you have to travel by car for good food. The only places that are drivable distance are gas stations, which I don't think you're going to get organic quality foods there as well. And a lot of our survivors didn't have, and by survivors I mean from the Indian day schools and residential schools, didn't get a good chance of education, and that directly leads to your employment, and that determines where you live, where you work, and that is a direct result to your health, right? And then you also go into that intergenerational trauma. Residential schools and day schools, the last one closed in 1995. And then there was Indian hospitals where if you were Indigenous, you had to go to a different hospital or a different wing. These were usually like the morgue hallways in the hospital or kind of like a dilapidated building. And those just closed in the 80s. So you look at all that intergenerational trauma, and these people that were survivors were kind of gaslit and like, that did not happen to you. Also, we're not going to give you therapy for something that didn't happen. So the only way you can cope can be negative strategies, unfortunately, and that's where we see those mental health problems with addiction. And that directly leads to how you cope with everything, right? Like your mental health, if you do not have the support and care to address that, that leads to your health. So these are all impacts on the social determinants of health. And those Indian hospitals, those people that had to go to those, are still living to this day. So there's already that sense of like, hey, if I self-identify as Indigenous, it used to mean bad care. It mean there's still systemic racism today, but it also meant like maybe I'm going to a different hospital. And in those hospitals is where we got a lot of advancements in science, right? Like we got our understanding of surgeries, vaccines, sterilization in those Indian hospitals. Just like the residential schools, that's the whole reason why we have a Canadian food guide, is because of the nutritional experiments that happened there. So unfortunately, there's all of this very recent stuff that has come from society in Canada where the Indigenous people are just rekindling that trust or distrust that's there. So why would you want to go to a hospital if those are just the recent events that happened? And unfortunately, there are still systemic racism, not just with Indigenous, but other people of color as well, and the LGBTQ trans. That makes it very scary to go into a hospital and say, hey, I need care. It's really farly too late in a lot of our communities. Don't have access to healthcare. Like there's no family doctors, there's no clinics. On Six Nations, we're fairly lucky that we do have a family doctor, but to go anywhere else for like emergency care, it's off-res. Do you have transport to get there? Do you trust these systems that are existing in those cities? So those distrust and all of these other factors in your social determinants of health, unfortunately, have made our statistics in health very worse, and it's really an epidemic right now. And that's what I tried to hone in on my students as I was teaching them, that we are in the epidemic, but this is how we can change it, is by making places culturally safe for them.
Why is it important to ensure that a hospital is more culturally safe and physically accessible for people of diverse backgrounds and heritage?
For sure. So culturally safe, I like to advocate culturally safe over culturally competent. You'll never be competent. I'm not even competent in Indigenous health. I know my community, I know Haudenosaunee teachings, but that's it. But culturally safe just means that you are feeling respected, you are heard, and you understand and you consent in what your healthcare treatment, your journey is. And that is good for everybody. So making places not just culturally safe for Indigenous, it makes it culturally safe for everybody. Women, people of color, like I said, our LGBTQ2 spirit brothers and sisters. it's going to make it more accessible and trusting that, like, hey, I can go there for health. And as they do more preventative strategies, that takes the less burden on the acute care, right, on our hospitals. So they have more trust in healthcare. It's just going to start benefiting everybody. And the physical aspect is actually getting there and doing all that. Again, for our people that are living with some disabilities, I have a learning disability myself, so making those places accessible, understood to our very diverse population is just going to also help them understand what this treatment, what their healthcare journey is going to be. Like I said, culturally safe is not just for Indigenous, it's for everybody.
Jessica Wilson is with us, a registered nurse at the RHN, the Waterloo Regional Health Network. We're on location this morning in the Uptown Waterloo Public Square for RedDAY. We continue the conversation on the Mike Farwell Show, 570 News Radio and Rogers TV. In the midst of a great chat with Jessica Wilson, who's a registered nurse at RHN, we were talking about culturally safe and accessible spaces a moment ago, Jessica. But what do you see RHN doing now to better serve our Indigenous patients and visitors?
Yeah, I mean, they got a long way to go, but they're starting, and that says a lot. We have an Indigenous employee circle, kind of like a resource group, but it's not just Indigenous staff, but it's also allies. And we do a lot of initiatives, and I would say even like reviewing policies and procedures at the hospital, but providing that Indigenous perspective. And it's those allies that are giving us a seat at the table and the power to actually do some change. So we appreciate that. But we are doing ceremony at the hospitals. Every season we do a sacred fire, a drumming circle. I think this summer we're also going to have an Inuit elder teaching at Chicopee site. So that's really fantastic. And just recently this week, we made some grandmother hand drums, 10 of them at the Midtown site for hopefully patient programming, community use, and these drum circle ceremonies for all the sites to use. So I'm really hoping those can get used in so many different ways, whether you're Indigenous or not. Being part of a drum circle, feeling that heartbeat of the mother and connecting with those drums is such a healing aspect. And RHN giving us that opportunity to look at health more than just that pharmacology and I would say the Eurocentric vision of healing, really starting to get that holistic view and trying to decolonize some of their practices. And that's truly what we're doing. But we also have Indigenous staff, and they're slow and growing, but they're small but mighty. So we have an Indigenous patient navigator that serves all of the sites of RHN. So there's just one for that. And then we also have an Indigenous navigator for the cancer care program and a coordinator. So they're really working at the regional level of like this area. So they look at Guelph and Cambridge as well. And they're there to support patients on their journey, whether that's accessing to ceremonies and elders, connecting them with like programs to get them to and from their appointments, also being a resource for staff. And on my end, I am also helping them kind of guide some education on Indigenous health and history, because unfortunately, Canada did a really good job at colonization, so it wasn't taught in school until very recently. So some of the working professionals in these hospitals have no idea. So they're starting at ground zero and just starting with those basics of understanding of who the Indigenous people are in this area, who you're taking care of, and what are kind of some of the disparities that we are seeing that we can help with that culturally safe lens, that two view seeing of like, here's the Eurocentric route, here's the indigenized route, and how can we do this in a very good way.
We are about 2 weeks away. It'll be 2 weeks tomorrow, in fact.
Yes.
June the 21st,
Yes.
National Indigenous Peoples Day. What is your message, Jessica, to the community in advancing truth and reconciliation?
Of course. So, yes, June is National Indigenous History Month, and that is really to celebrate those First Nations, Métis, and Inuit communities and their resiliency. We're still here. Even though there were so many things that tried to knock us down, we're still here. But reconciliation is every day. Every Child Matters is every day. Missing and murdered Indigenous women, Two-Spirit people are every day. So take an active role in learning about reconciliation. Look at the calls to action. Is you yourself or your organization following those? Where do you live? What treaty are you under? What does that mean to be part of that treaty? And really start to support and advocate Indigenous causes, because there's still not clean drinking water, even just on Six Nations, which is an hour outside of Waterloo. There are some Indigenous reservations in Ontario that have been dealing with lack of clean drinking water, which is a basic human right, for over 50 years. That would not happen in a city. And see where your organization is at those calls to action. And attend community events so you can learn. There's a lot of things that are happening in the region this month. There's a multicultural festival happening June 21st. Me and my mother, she's an artisan, she'll be there. SoHack will also be having like a vendor fair as well, and that is in Cambridge. The University of Waterloo is going to have a celebration on June 19th with Elder Henry Maigan. And just check out your local organizations or see what your city is doing to promote it. But there is one thing I want to say for those that are working in healthcare in Ren. One call to action that I really want to promote today is number 22. We call upon those who affect change within Canadian healthcare systems to recognize the value of Aboriginal healing practice and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders when and where requested by Aboriginal patients. And that is an Indigenous right. Look at our rights. Look at the Indian Act. Understand how that still impacts us negatively today. Look at the United Nations Declaration of Indigenous Peoples' Rights, and also look at what maybe your government is doing against Indigenous rights and advocate and support us. There's a lot of us left, but it's truly our allies that give us that voice that's a little bit higher. And with that allyship, I've also had a voice on being part of the new hospital that'll come to the region many years from now, but maybe when I'm older, I'll be a patient, but...
Me first.
Yeah. No. But we're making sure the Indigenous health space is being done in a good way, making sure there's an Indigenous architect, there's Indigenous teachings, and there's space. So we're not an afterthought this time. So I feel like, we're an afterthought trying to make Indigenous spaces here in the Ren now because these hospitals weren't meant for us there, and making it more accessible for these ceremonies, and so that we can do more ceremony in patient rooms, and that the hospital has that culturally safe understanding view, and I'm going to say kind of like wayfinding throughout as well. So I'm very excited to be part of that and make sure that we are there and it's done with a good mind and intention, with community input with our elders as well. It's not just one voice, one token Indigenous. There's a lot of voices through it. So know that the new hospital has thought of us, has thought of the land. There's been ceremonies done to make sure that the land has given us consent to build on that land. And it has been discussed with the Indigenous confederacies that live near us, that are the rightful owners of that land. So know that this is being done the best way that we can, with a good mind, our Gunaquio, and with our elders. But thanks, Mike.
there is an energy and an enthusiasm that just oozes off of you, Jessica.
Thank you.
You must enjoy the work that you do.
Oh, I absolutely love it. This is my passion, like to talk about Indigenous health and history. I think I'm Indigenous and I do love healthcare. There's so much to it. And being able to combine both of these is just a passion, and really trying to advocate and make some change, even if it's small. It's something I'm trying to do right by the community, by my parents who are both residential school survivors, because they didn't see this in their lifetime. So being able to do anything that I can to make it better for the next 7 generations, or even my child, so they have it a little bit easier, is so significant and so pivotal that I don't even think maybe Ren understands that some of the things they're doing. Then I'm like, you're making history. I don't think you understand that, but you truly are, allowing us to do some Indigenous ceremonies. But having a seat at these tables, like I said, with my allies, is how we start to do that. And I said to them, I'm like, I'll take the seat, but if somebody better comes along that's more experienced, I'm happy to have them, but I don't want to lose that seat, because this is where we can start to get more people as we go across, right? Because also, it's that trust. Like, there's Indigenous people out there that are qualified, but also that trust to work with a Eurocentric organization like Ren. But they are doing what they can in a good way. I know there's a lot of politics that may limit them, but also challenging those politics in a decolonized way is also what I'm doing as well. But such a passion for this, and I'm hoping that as time goes on, this Indigenous health team grows. There's more, I'm going to say, culturally safe policies, and we don't have to be like, how do we get Indigenous people to feel safe in the hospital? It'll just be truly a thing. And I said this with my team the other day, the more that we start to address these disparities in the indigenous social determinants of health. Like, so once we start to fix those inequities, we're not going to need those indigenous patient navigators anymore, because there won't be those disparities. Will we see that in our lifetime? I don't know. One can hope, but this is how we get there.
I really enjoyed the conversation. Thank you very much for joining us.
Thank you.
Jessica Wilson is a registered nurse with REN here on the Mike Farwell Show, 570 News Radio and Rogers TV. I feel like we should have a quiz by the end of the show today, because if you're an old fart like me, it wasn't even Grand River Hospital, right? It was KW Hospital back in the day. But now REN at Midtown. St. Mary's, REN at Queens Boulevard. Freeport, REN at Chicopee. All under REN being the Waterloo Regional Health Network. WRHN, it is REN. And we are celebrating all things healthcare on this RedDAY, on location today in the Uptown Waterloo Public Square. Have you ever thought about pediatric cardiac care? Yeah, me either. I didn't even know, in fact, it was a thing until I got here this morning. But we'll learn more about that thing coming up as we continue our on-location broadcast in the Uptown Waterloo Public Square for this RedDAY on the Mike Farwell Show. 570 News Radio and Rogers TV. What a beautiful day to be outside. I should thank my buddy Cooney. I give him a hard time when the weather's rotten, and the weather has been rotten, but not today. Beautiful day out here in Uptown Waterloo as we celebrate RedDAY and all things healthcare in our community. Joined now on location by Trish Blancher, who's Program Director of Children's and Childbirth Program at REN. Good morning, Trish.
Good morning.
And Sarah Young is with us as well, Clinical Manager of Pediatrics at REN. Sarah, good morning to you.
Good morning, Mike. Thanks for having us.
It's an absolute pleasure. Been really enjoying these conversations so far, and I'm quite curious as to the conversation we're about to have because I never personally put pediatrics and cardiology together. So let's get into that, Sarah, and I'll start with you. This new program at REN focuses on pediatric cardiology, which is an area of focus that Waterloo Region did not previously have. So how does it work, and why is this so significant?
Yeah, so we are very fortunate to have Dr. Jonathan Schweber, who's joined our team. He's a pediatric cardiologist. He doesn't live in town, but he's been making the time to come into Kitchener-Waterloo to be able to serve the patients in our region, because we know that that's an area that has had a gap in cardiac care. So we run our pediatric cardiology clinic out of our children's outpatient program. So this clinic was originally set to run once a month, and we've now grown it to be running every week. So it's really taken off, and it's a great service to now be able to offer to patients close to home. So the biggest reason why we wanted to offer cardiac care in the KW region is so that our patients don't have to always travel to a tertiary center in Hamilton, London, Toronto to have their cardiology tests done and to have cardiology consults. We wanted to be able to offer those within our region. So our program serves neonates all the way up to age 18. And it's also helped us to keep children out of the emergency department because these kids were waiting so long to be able to get into those tertiary care centers to be seen by a cardiologist. Now having another option for these patients to get in sooner has helped to shrink the wait list for the tertiary centers, as well as get the patients that are in the KW region seen sooner. So through the clinic, we offer cardiac echoes. So we have 2 cardiac sonographers who have joined our team. They did adult work at our Queens Boulevard site, and now they're training to do pediatric work over at the Midtown site with REN. So Dr. Jonathan Schweber has been doing all of their training thus far. So they have shadowed him. They've done some extra days at MAC to spend time with those cardiac sonographers to get comfortable doing pediatric scans. So we're able to offer pediatric echoes as well as ECGs and a consult with the cardiologist all in their hometown.
Absolutely incredible. So I always feel like I'm talking about a superhero movie when I bring this up, but I like the phrasing. And Trish, I'll ask you about the origin story, right? Maybe we should talk about Dr. Schweber being a superhero in this regard. But what is the origin story of this program, and how has it evolved?
Absolutely. So, of course, we've known that there's been a significant need in our region for some time, for many years actually, and it's taken a lot of advocating to bring some services closer to home for our families. Specifically, though, over the last few years, as a result, kind of on the outskirts of COVID, there has been some targeted funding available through the ministry that's been specific to keeping kids as much as possible out of the emergency departments. So they call it ED diversion. So the idea of, can we keep the less appropriate children, kids that didn't maybe necessarily need to sit in the emerge and have the long wait time, and have them seen in an appropriate clinic and outside of the emergency department. So this clinic was perfect. It really fit the bill for that funding. And then together, of course, with our foundation and our donors in our community, we were able to get the funds together to get this program up and running. So we started with, how many kids might be impacted by cardiac work in our area. And so we started with just a simple, 1 clinic a month, 2 clinics a month. We've very quickly evolved to weekly. This program actually just got started in August of last summer, the end of last summer. And so we're quickly seeing the need, and the volumes are rising. And such appreciation from our families to stay close to home and not have to travel outside of the region where they have to take full days off work. The kids, it's anxiety producing for the kids. So something in their own local neighborhood being seen quickly, reducing that wait that was often 6 to 8 months to be seen outside the region. We're now able to get them in a fairly timely fashion in our own clinic. So we're just so fortunate to have not only the funding, the support from the community to help the ongoing support with the equipment, but at the same time, just keep those kids close here where they feel comfortable.
What a milestone. And it must be so rewarding to do the work that you do in this regard.
Absolutely. Seeing what used to take families, 6 to 8 months to be seen just for an early diagnosis, to now be able to see them, depending on the diagnosis and the reason for the visit, it can be anywhere from a few weeks up to a few months, but to reduce that time significantly and to get them that early detection and early awareness that there is a cardiac issue, and then get them onto the appropriate solutions and treatment plans through our physician, Dr. Schweber. So we are so fortunate to have this program.
Yeah, it is certainly a sign of progress that is made in part through days like today. It is Red Day. I'll remind you to visit the website redday.ca. And remember, Manulife matching up to $200,000 in donations today. Again, redday.ca. Trish Blanchard is the program director, Children's and Childbirth Program. Sarah Young, clinical manager of pediatrics at REN. We're going to continue the conversation, so please do stay with us on location in the Uptown Waterloo Public Square on the Mike Farwell Show today, 570 News Radio and Rogers TV. It is Red Day. I'm wearing my red. Hope you are too. We're splashing red across the community today, and we are visiting the site redday.ca, where we can make donations to support healthcare in our community, and Manulife is matching up to $200,000. Trish Blanchard is, I was going to say in studio. That's just an old habit because we're in our outdoor studio with us today.
Absolutely.
Trish is program director of the Children's and Childbirth Program. Sarah Young here as well, clinical manager of pediatrics with REN. Trish, let me ask you about government funding, which is not included or got this program started, but can you talk about the impact of how the community can help to support and advance this pediatric cardiology program?
Yeah, thanks, Mike. It's a great question. Without our ongoing community support, we couldn't make a program like this continue. Not only is there the operational of paying, obviously the staffing and the stenographers for the work they're doing, but it's very specific equipment that we need actually to care for children. So we can't take the adult equipment and make it kind of work for children. So we had to do some specific work with our foundation and through our generous donors here in our community to purposely buy further equipment that will do ultrasound cardiology for children and the neonate population, who are, of course, very tiny, so that we can get the right readings and the right outcomes for these babies. And so that was upwards of $300,000, and that was all made possible through our generous community donors. We're so fortunate for that support and ongoing support to keep this program running. You know, without this program, unfortunately, our children would have to, again, go back to the wait lists of our outside the community resources such as McMaster and Sick Kids, which are amazing resources. However, their wait lists are quite long, and our families have to travel quite a distance to access those resources. So keeping this close to home with the same specialties and to be able to offer this service for our most vulnerable children, we're really proud of that, and really proud of our community for helping and contributing and keeping this program moving forward.
Sarah, on RedDAY, we talk an awful lot about healthcare with a focus, of course, on preventing heart disease for adults. But when it comes to children, there doesn't seem to be a whole lot you can do to prevent these things, especially if it's a condition they're born with. So for kids, is early detection the game changer? Like, how does this pediatric cardiac program give parents the answers they need and the answers they need quickly?
Yeah, for early detection and early diagnosis, it's key to be able to come up with a proper treatment plan for these patients. So the sooner that they can be seen by a cardiologist, the better. And like we've mentioned, the main goal of this clinic is to be able to get kids in sooner and keep them in our KW region without them having to go to these other centers to just obtain their diagnosis. So it's been really beneficial for our patients and our families. The clinic's been really well received. We continue to grow. Dr. Schweber is actually talking now about trying to expand even further. We're adding a third cardiac sonographer to our team shortly. So we really see this being a fabulous service that we can now offer to Kitchener-Waterloo to ensure that we're getting that early detection and early diagnosis for these patients.
It kind of breaks my heart a little bit to think about these kids that are dealing with these issues. How rewarding do you find the work?
Well, I mean, like you say, it's often, you know, we want every child to be healthy and born healthy. But unfortunately, sometimes children are born with predisposing, you know, conditions or risk factors. And so knowing that we have very quick turnaround time and seeing even our newborns, if required for a cardiac concern here and not having that wait time, I think that in itself, if we have to have a concern with health, knowing that we have the services here locally to respond as quickly as we can and to bring the best practices forward to make sure the child has the best outcome and the fastest outcome possible moving forward. We're really excited to be part of this and part of a really amazing children's and childbirth team.
Yeah. Sarah, this has got to be really the biggest part of this, because we've talked about not having to leave the community to get this, right? No more traveling to McMaster or whatever. We have this care now right here in our community for the youngest among us.
Yeah, we're so fortunate to have a cardiologist who's willing to take the time to come to our region and serve these kids. It's been a gap that we haven't had in KW, and it's a great opportunity for us to finally fill that gap, keep kids close to home and out of the emergency department.
Yeah, and to be able to accomplish this in the region of Waterloo, as we're in this really interesting space for healthcare, I think is a testament to the community support as well that you talked about earlier.
Absolutely. We have a growing community. We have a diverse community and a community that has always come together to help support the healthcare system when in need. So RedDAY events like today, unbelievable to look at cardiac prevention, because no one plans for this, especially in the children. So being able to offer this support to families when they're often having the most anxious day, finding out about a condition that might be impacting their child, unbelievable that we can provide this support.
What does the future of this program look like?
It's growing, and I can see that it will continue to grow. As our population grows, so does our need for healthcare and specialized healthcare, especially in our children. So I think having this program close to home, already seeing in a short 10 months how fast the program has grown. We see it continuing to grow, with, of course, the support of our community and our donors. Yeah. So thank you.
Thank you both for the work that you do. It's a compelling story. Love learning the origin story of this and something else that we've accomplished in healthcare here for our community. Thank you both for being here today.
Thank you. Thank you.
Thanks, Mike.
Good luck.
Trish Blanchard is Program Director with Children's and Childbirth Program at the Waterloo Regional Health Network. Sarah Young, Clinical Manager, Pediatrics at REN. We are on location in the Uptown Waterloo Public Square today for Red Day as we celebrate healthcare in our community. This is the Mike Farwell Show, 570 News Radio and Rogers TV. It is a great day to be outdoors, and we welcome you to the show and thank you for being a part of it, as you are every day. I probably don't say it enough, do I? I appreciate you. I appreciate the time that you spend with us. And today our time is being spent in the public square in Uptown Waterloo, a beautiful day to be outside, and we are celebrating healthcare in our community. Remember, there will be a pop quiz later on. We have to get used to these new names, right? And it's tough. The older you get, and if you are as long in this community as I have been, I know you get used to Freeport and St. Mary's and KW Hospital or Grand River. But under the Waterloo Regional Health Network, WRHN, or REN, as we call it, approved that merger by the Ministry of Health back on April the 1st, so just a couple of months now. But what we have long known as Grand River Hospital, or KW, becomes REN at Midtown. What we have long known as St. Mary's Hospital becomes REN at Queens Boulevard. And what we've long known as Freeport becomes REN at Chicopee. And of course, this is all leading up to the ultimate creation and construction of our new hospital, our new acute care hospital up in Waterloo, just off Behringer Road on grounds at the University of Waterloo. When last we checked in with our hospital CEOs, the plan is still on track. The goal is within a decade. It's pretty ambitious from where I'm sitting, and I know you and I have talked an awful lot over the years about the pace of public infrastructure projects, but this is a critical piece of infrastructure. We were reminded on the show earlier today, the provincial government, in its most recent budget. Hey, when's the federal government doing a budget anyway? I'll just leave that aside. But in the most recent provincial budget, $10 million was granted to our region and the REN to continue moving forward with the studies that will get that construction underway. But the plan, let's call it 2035, this new acute care hospital being open. As we are on location today to mark Red Day and the celebration of healthcare in our community, it is an opportunity for us to do our part. Remember, and this is something I had to learn over the years, but we think about healthcare being a provincially funded issue, which it is. There is a Ministry of Health, but the funding only funds the staff in those hospitals, the buildings themselves, not the equipment that goes inside. That's where the community is called upon. And if you think about the billions that it will cost for the new hospital to be built, the consensus is that it's about 1/10 of that will have to be fundraised for the equipment to go inside. So we're talking in the hundreds of millions of dollars over the years that will have to be generated in our community in order to properly equip that hospital. Boy, oh boy, did we get a great piece of that. Remember, Manulife today on Red Day is matching donations up to $200,000, and we have received in the last 30 minutes or so right here an offline donation at the public square of $25,000. The donor wanted to remain anonymous, but they have made the donation here on Red Day, matched up to $200,000. So there's matching from Manulife on a $25,000 anonymous donation that's already come in this morning. Incredible stuff. And if you want to be a part of the fundraising, you can go to redday.ca. You don't have to donate $25,000, but nobody would complain if you did. It could be $25, whatever it is. But redday.ca is your opportunity to make that donation and make that impact on healthcare in our our community. Manulife matching up to $200,000. This is the Mike Farwell Show, on location today at the Uptown Waterloo Public Square on 570 News Radio and Rogers TV. We are on location today. What a beautiful day to be outdoors. And I always enjoy our Red Day celebrations as we celebrate all things healthcare in our community. Dr. Peter Potts joins us in this segment. He's the Chief of Staff at the Waterloo Regional Health Network. Peter, good morning.
Good morning. Good morning, folks, and happy to be here. Pleasure to be here.
It really is a pleasure to have you here. And Becky Stewart returns. She was so good when last she was a part of our Red Day. She's back again. Executive Project Director, Service Planning and Operational Readiness at REN. Not too much on your plate these days with the new hospital and all that stuff.
All good. Pleasure to be here this morning.
It's a pleasure to have you back as well. Becky, let's start with you going back about a year now to July of 2024 when we learned that this new hospital was going to be built on the David Johnston Research and Tech Park, where I just was yesterday. Great place. Why is it that we are building this new hospital?
Well, Mike, by 2051, this region is expected to hit 1 million people. So we are growing fast. We're one of the fastest growing regions in Ontario, and we want to support the region to be 1 million ready by 2051. So in order to support the population with excellent healthcare, high quality access when and where you need it, we need infrastructure to do that. So our current sites are aging, and we can't grow them to the extent that we will need to meet that million ready need. So we need to increase our footprint, we need to increase our number of beds, we need to increase our ability to see patients in the emergency department. Each year, about 700,000 people receive care across REN. And that's only going to continue to increase. So we want to be ready with a new facility, new infrastructure, able to leverage the latest technology to be able to deliver an amazing care experience to the people of Waterloo Region and beyond, because we have so many regional programs as well.
Peter, when you think back on the why, what comes to mind for you?
Well, I would agree wholeheartedly with Becky. You know, the history of our hospitals goes back over 100 years. St. Mary's just recently celebrated their 100th anniversary, which, you know, is incredible. But it speaks to the age of the hospitals. The infrastructure is just not adequate. We have a very, very dynamic, growing entrepreneurial community. And we also have an entrepreneurial and growing healthcare system, but our infrastructure is it's aged. And I think we've done what we can with it, but its day has come and gone. We just really need new infrastructure.
So since the site announcement was made, how has progress been? What's been happening?
Well, we've been working very actively, on many different levels, with many different levels of government. I think we've made tremendous progress in terms of beginning to lay out the sequence of the building of the new hospital, the renovations and the rejuvenation of our existing hospitals. And we're now down to program planning, functional programming, and really looking at the detail of how the hospital will be laid out by program in much more detail. So I think we're moving ahead very quickly.
The merger is actually a huge part of that. And I don't know if you want to talk a little bit more about the merger, Peter, but the merger was a really key enabler of also proceeding with this work, because we wanted to make sure, as much as our organizations previously had a really stellar and long history of working together, the merger and the union of the hospital was really an imperative to continue this work going. So do you want to?
Yeah, because that's interesting, because for us, right, the lay people in the community, it's just, St. Mary's and Grand River come together to become the Waterloo Regional Health Network. It's almost just like a name, but internally, what does this look like and mean?
It's much more than a name. So on the clinical clinical side, we've worked together for many, many years. So it wasn't a heavy lift clinically, but administratively, we had two distinct corporations. And it was quite clear in speaking to the ministry, they had no interest in two separate corporations sharing a hospital. Deciding who was going to put out the garbage was going to be a big lift, right? So the ministry said, you need to operate this as one hospital and one administrative structure, and so that led us to come together. But I think it's the right decision for the right time. We'll be a much bigger player on the provincial scene as the Waterloo Regional Health Network than we were as individual hospitals. Our budget will be over $900 million per year, which will put us in probably the top 10% of Ontario hospitals. So we'll have a voice provincially, which is really important with the growth of our existing programs and then onboarding new programs. You need a voice with the ministry, and I think we'll have that. We have that voice as an entrepreneurial community, but we now have that voice as demonstrating that we can come together and work cooperatively. So I think it's much more than just a name change. It's really fundamental to the way healthcare is changing in the community.
What are some of the general principles that will guide the construction of this new hospital?
So a number of things. Becky and I can probably both speak to that. I think I'll start with a nod to the environment. We want to have a hospital that's built on a sustainable model. We want to recognize the potential for climate change and have our hospital be resilient around climate change. We want it to be open. We want it to be welcoming. We want people to feel safe in the new hospital, both, physically, socially, emotionally, and particularly we want them to feel culturally safe. We want it to be open to the diverse cultural makeup, of our community. We want every culture, including our Indigenous folks, to feel welcome and to feel like the structure, represents them, is welcoming to them, and is useful and to them. So those are some of the principles. I don't know if there's some others, Becky.
And I mean, my role in this process is always to remember, first and foremost, we're building a hospital. So we need it to function as a hospital. So how do we make sure we have the space, the design, the equipment, everything that we need to deliver excellent care. So we want to achieve all of that, but we want to achieve it in a way that also, first and foremost, reminds us that we are a hospital. We do amazing things every day. So how do we create the spaces to be able to keep doing that? And how do we do that with a really innovative mindset? Because as Peter said, part of sustainability is also thinking about how do we remain flexible. This is a 100-year hospital. We are not, building this hospital for the seniors of today. We're building it for you and I, Mike, who will be
Thank
the
you
seniors.
For that, Becky. Trust me. Thank you for that.
Who will be the seniors of tomorrow. And so it's really important we think about innovation and how we can continue to respond to not only how Peter said changes with climate change, which is not something when you were planning a hospital 30 years ago you probably even thought about for 2 minutes, and now it's something we think about all the time. So how do we make sure we're embedding innovation in everything we do? And it is baked into our design vision for this organization, because we want to make sure that we're able to really be good stewards of this organization and have it grow and evolve and change as the community's needs do over that next 100-year period. And I think what's really important to remember as well is this isn't just about the new hospital. We are still about 10 years out from, being able to open. So how do we renovate the Midtown campus to be able to continue to, again, grow and respond? How do we expand Chicopee to make sure we have that post-acute capacity as well? But how do we also continue to support Queens Boulevard to be able to, as Peter said, 100-year-old infrastructure? How do we continue to support that site to provide care until the new site is ready to go?
I like that point. I mean, we talk a lot about being 1 million ready, but this is a 100-year hospital. It'll outlive all of us sitting here at this table, and many of us listening today, believe you me.
Oh, it's getting bleak.
No, I don't mean to be that, but it's important to think that way, and I heard about that during the site selection process too.
Totally.
So.
And Mike, Becky makes an incredibly important point. We don't know what healthcare is going to look like in the next 10 years, far less the next 30 years. So we want the walls to be fluid. We want the infrastructure to be fluid. We want it to be able to adapt. And, as technology changes, as healthcare changes, this hospital has to keep up. So we're very, very, very mindful of that.
And we learned that during COVID. Right? When you have spaces in your organization that are meant to do a very specific thing, when you suddenly need to call upon them to do something different, that can be very challenging. So we're able to recognize that, hopefully COVID was also a once in a lifetime sort of thing, but we know it's probably not. And so how do we set our future selves up for better success, being able to respond to those types of public health emergencies as well?
Becky Stewart is the Executive Project Director, Service Planning and Operational Readiness with the Waterloo Regional Health Network, and Dr. Peter Potts, Chief of Staff at REN. We continue the conversation on the Mike Farwell Show this morning, live on location in Uptown Waterloo, 570 News Radio and Rogers TV. In conversation with Dr. Peter Potts, who's the Chief of Staff at REN, and Becky Stewart, Executive Project Director, Service Planning and Operational Readiness. Becky, let's talk about the partnerships, which are across all levels and sectors, which are, of course, key to the success of this new hospital building that we've been talking about. Can you share with us how these partnerships that are underway already in support of the new hospital are working?
For sure, Mike. So we can't do it alone. This is definitely a massive project, takes a village. So I think first and foremost, our partnership with University of Waterloo has been key so far. So not only is the site, part of the campus, but we have really leaned into that relationship, looking at opportunities to partner around those pieces around innovation, technology, some of those environmental pieces around climate change and how we can make the site really sustainable. I've had a great opportunity to teach a couple of engineering classes with some of those partners, so it's been great, and we're just really looking for opportunities to continue to grow and build on that relationship. And we're so fortunate to have the post-secondary education institutions that we have in town. It's going to be a huge enabler of success going forward, and it's been really great to engage the students, because as I said, we're not building this hospital just for the seniors of today. They will be the seniors of tomorrow. And generationally, very different expectations of how they want to receive their health care. So that has been really interesting, and it just reminds us that we're designing and planning for people that might not be patients today, but they'll be patients in the future. So that has been a key relationship to tapping into some of those inputs. And then the other big one is our municipal partners. So we can't build a hospital on the site until we have sewage and hydro and running water and all of those things that are really important for running a hospital. So our municipal partners have been just absolutely fantastic at coming to the table and saying, what can we do to start to get the site ready for construction? We'd like to have shovels in the ground in 2027 with the goal of having the new hospital fully online in the first phase by 2034. So it's all dependent on Ministry of Health approvals, but that is our goal, and we wouldn't be able to be moving so quickly without the support of all of those partners. And I don't know, Peter, if you want to touch on the education partnerships.
Yeah, absolutely, Becky, and thanks for that. We've had a long-standing relationship with McMaster University, and in fact, we actually have a regional medical school. Many people may not be aware, but down on Victoria Street, we have 52 students training, to be physicians through McMaster. So we've had a long-standing, very important relationship with McMaster. So we have the good fortune of having a strong relationship with McMaster on the health sciences side, and then, as Becky said, a strong relationship with University of Waterloo on the science, technology, engineering, and math side. So we're incredibly lucky in this community. And so, when we look to healthcare, we look to, leverage those two institutions. And both institutions are very keen to be involved. And so we'll leverage them, and we'll find ourselves hopefully at the center of that really interesting triangle of McMaster and University of Waterloo going forward.
I know there is a great deal of anticipation about this new hospital building. Peter, what would your message to the community be as we look forward to this next step, this 100-year hospital in our community?
Well, I think, first and foremost, as Becky said earlier, the community is growing incredibly. We expect to be close to 1 million people by 2051. One thing that people don't always realize is that these hospitals not only support Kitchener-Waterloo, but they support people all the way up to Tobermory, for example, Tobermory, WRHN, all along Lake Huron shoreline, into the Grey Highlands, Collingwood, Thornbury, Guelph, Stratford, Cambridge. We have 6 regional programs that support a catchment of well over 1 million people, upwards of 1.4 million. So I think my message to folks is that we're building a regional hospital for a large catchment. We can do this. We need to do this. Our infrastructure is far outdated. Our 2 hospitals date back over 100 years, and we need new infrastructure to move forward. And I think once the doors open, people will be justifiably proud of our healthcare system and our healthcare infrastructure, like they are of so many other elements, of Kitchener-Waterloo. So I think it's something we should rally behind, that I think it's something we can definitely do and that we'll be very proud of for generations to come.
Becky, what about you?
Well, I think I would very much agree with Peter, but also, this is a community that has always rallied around healthcare and supporting healthcare in our community. Building new hospital infrastructure is expensive. Outfitting that infrastructure is expensive. And as we talked about earlier, we don't just have the new hospital to think about. We have that expansion at Chicopee, renovation at our Midtown site, and then continuing to support Queens Boulevard over the next, 10 plus years until we're fully ready to go. So as we look to that evolution and growth and, managing over the next decade, we're really going to be, again, looking to our community to really continue that support in many ways, and providing their input and their engagement around development is going to be huge. I think this is the best place to live in Ontario. I grew up in Guelph and came back to KW because it is a region that is so vibrant, and this community has been so supportive, and we're just really going to be counting on everyone to continue being so supportive as we all go on this journey together.
It's really something that the community is excited about, something to look forward to, and it's really great to learn the competent hands that this development is in. So thank you both for being here with us this morning.
Thanks for having us, Mike.
Thanks, Mike.
Becky Stewart, Executive Project Director, Service Planning and Operational Readiness at REN, and Dr. Peter Potts is the Chief of Staff. Joining us on the Mike Farwell Show, on location this morning in Uptown Waterloo, 570 News Radio and Rogers TV. Just ahead of our update in the 570 News Center, getting word from the National Hockey League moments ago. The Dallas Stars have parted ways with former Kitchener Rangers head coach Pete DeBoer. 3 seasons in Big D for DeBoer and Spot. And you got to think time might be starting to run out on the guy that was so successful here in the Ontario Hockey League and has been successful at the National Hockey League level, but has not yet got that elusive Stanley Cup. I sure hope another team scoops him up and gives him that chance to win that Stanley Cup. Speaking of hockey, as you would have known for sure, Adam Valentini is now a Kitchener Ranger. That announcement being made yesterday, and a big signing for the Kitchener Rangers of a kid who had NCAA aspirations, but now with that rule change will be here. It's going to be an exciting year in Kitchener. Believe you me, the season ahead. It's an exciting day here in Waterloo. We're on location at the Uptown Public Square, celebrating healthcare in our community. It is Red Day on the Mike Farwell Show, 570 News Radio and Rogers TV. It is a beautiful day to be outdoors. We are enjoying the outdoors, and we are celebrating healthcare in our community on this Red Day. Jamie Wilson, the Vice President of Development, and Jason Lemieux, Chief Marketing Officer with Manulife Canada, join me here on the show. And of course, I'll remind you that on this Red Day, Manulife Canada matches up to $200,000 in donations. Jamie, let's start with you, because Red Day as we know, we've talked about this over the years, a long-standing tradition now in the community, thanks to the strong partnership with Manulife. Can you take us back to the beginnings of this relationship and how it came about?
Yeah, you're right, Mike. We have enjoyed a very great partnership starting in the year 2000, actually. And I think it was conceptualized as an LPGA event, which then evolved into a hike and bike. And then, again, a further evolution into the RedDAY that we know and love now. So Manulife has been with us through our growth, through all of these instances and evolutions of this event, and have supported cardiac care in lockstep with us for decades. And their contributions have enabled, and then their donations outright of almost $5 million over the years to support healthcare in our region.
I remember that Manulife LPGA Classic and the RedDAY that was a part of the tournament. And my gosh, those origins, I'd almost forgot about that. Interesting story. So, Jason, why is it that Manulife wants to focus on prevention as its priority?
Yeah, great question. We're really excited to partner with the Health Network in the Waterloo region. Prevention for us, if we think about what we're trying to do, we're trying to be the trusted health partner for our customers and Canadians. And as an insurance company, we're involved in the health journey of all of our customers. But we've historically paid claims. Whether it's a vision claim or a dental claim or a drug claim, or on the life insurance side, a life insurance claim. But there's so much more we can do along that journey. And as we look at prevention and the power of prevention to make Canadians healthier, it really is an opportunity for us. It's a win-win for our customers who are going to live longer, healthier lives. For us as an insurer, for employers who these folks work for, and for taking pressure off the healthcare system. And so we've really worked hard to embed healthy choices and embed, health as an outcome into our products. If you think about Manulife Vitality, if you think about our group benefits app, a mobile app, they're all embedded with, features and programs to encourage healthy behaviors, healthy choices, Aeroplan rewards, education, all really designed to drive a better health outcome for our customers. And as we think about turning into the community, opportunities with the St. Mary's Prevent Clinic are fantastic. If you think about the ability, up to 80% of cardiac incidences can be avoided through healthy choices and early detection. The ability to partner with St. Mary's and power the Prevent Clinic was a real opportunity to, again, have that positive impact on Canadians and our customers.
I saw our buddy and community champion Ron Caudle demonstrating what that Prevent Clinic was all about on some social media posts over the past week or two. It was great to see. So, Jason, I know that empowering sustained health and well-being is one of the core pillars in Manulife's community investment strategy. But what does Manulife hope to achieve through this dedicated focus?
Yeah, absolutely. As we think about, our business and what we're trying to do from a business, community investment and our impact on the community and what we call our impact agenda is incredibly important to us. And we really want to align it with our strategy to have as much impact as possible. And so as the health and prevention is one of the pillars of our impact strategy. And what we're really looking to achieve out of it, if I think about it in two buckets. At the individual level, we're really trying to help our individual Canadians make better health choices in order to live healthier, longer lives, but also to really zero in and improve those health metrics that they can, whether it's cholesterol, whether it's blood pressure, and the types of things that the Prevent Clinic focuses on. At a macro level, if I think about societal impact, we're really trying to help the community be healthier, really reduce all of the the risks associated with heart health, and we're trying to reduce the impact on the healthcare system by preventing these diseases as best we can up front.
Jamie, how do partnerships like this partnership with Manulife help REN and the foundation think more long-term and maybe innovatively about healthcare delivery and prevention?
Yeah, great question. I think ultimately, partnerships like the one we have with Manulife allow us to think of healthcare in a different way. How can we tackle the way we do healthcare, from different perspectives. For example, prevention, not just waiting until we see people come through the emergency department, for example. How can we intervene on some of those things? So a partnership with Manulife empowers us to be able to support absolutely fiscally, but also to inspire the community. So today is a perfect example. Manulife's $200,000 match. Hugely inspiring to the community to know that every dollar today is matched. So we're mobilizing community. We're thinking of healthcare in a different way, and we're inspiring big, innovative moves in healthcare in our region for the future. So exciting.
Yeah, it's really exciting. And Jason, just while you're here, to anybody at Manulife who will listen, or if you've got the pipeline to the top, I don't know what it is, but it's always nostalgic for me. And it's not Christmas, it's not the holidays, until I see, don't ever change what Manulife does on its building in Waterloo, okay? Because the green Manulife sign with the red seasons greetings, it's perfect, it's simple, it's classic. I never want to see it go. Please help, okay? Make sure it never happens, never changes.
Will do. I will let the powers to be know.
I had to bring it up, because every time I'm cruising by on the expressway, I see it, and that says the holiday season. Thanks for everything you do in the community, and certainly supporting RedDAY. Appreciate it.
Well, and thanks for the time today.
Jason Lemieux, Chief Marketing Officer with Manulife Canada. He's taking my message to the top. It's going to stay decorated for the holidays, that Manulife building in Waterloo. Jamie Wilson, Vice President Development with the Waterloo Regional Health Network Foundation, joining us here at RedDAY on the Mike Farwell Show. 570 News Radio and Rogers TV. Can we have some real talk together here this morning? I mean, that's what we always do, right? We have real talk on this show, and Jason Lemieux, the Chief Marketing Officer of Manulife Canada, was just on the show with us alongside Jamie Wilson, who's the Vice President of Development with the Waterloo Regional Health Network Foundation. And they talked about the Prevent program, which was a new program started about a year ago with investment from Manulife. As you know, Manulife matching dollar-for-dollar donations today on this RedDAY, up to $200,000. You can make your donation at redday.ca. And we actually received earlier this morning, right here on site, an offline anonymous donation of $25,000. Incredible stuff. Yours does not have to be a $25,000 donation. It can be a $25 donation or a $50 donation, because that becomes a $50 or a $100 donation thanks to the match from Manulife, up to $200,000 today. But when it comes to the real talk I mentioned a moment ago, and this Prevent program that was started back in 2024 with investment from Manulife, I think on this, and just to be upfront with you, I complain about it a lot. Not the Prevent program, but what the program does, which helps those at risk of heart disease by tailoring treatment plans that can mitigate that risk, including helping patients stop smoking, improving diet and exercise, and managing other health issues that could lead to heart disease. The middle one there, improving diet and exercise, is the real key. I am a many decades removed. I did that smoking thing for a very short period of time. I was working in a factory when I was in high school and just beyond, and it's just a lot of people there did. And then I got into landscaping work, and our morning tradition was to stop at the Tim's and get our coffee, and I was a Boston cream guy back then, and have a smoke before you went out on the road. It didn't last long, a little less than a year. It wasn't too hard for me to quit. But I know how difficult it is. And if you are able to quit, and maybe the Prevent program can help you, it obviously goes a long way towards improving your long-term healthcare outcomes. Healthcare, not sick care, right? Think of that Prevent program. But the improving diet and exercise piece, it's funny, when Jamie was here, Jamie Wilson, the director of development, or vice president, of development with the RHN Foundation, and she said, I didn't bring you butter tarts this time because I heard you were all butter tarted out. And there were a lot of butter tarts. There were a lot of butter tarts during Farwell for Hire this year, as there almost always are. In fact, I picked up some more from Snickle Fritz Kitchens while I was on location yesterday when we went out to the Research and Technology Park to celebrate the end of a busy fundraising month and have a couple of beers and Why not have a butter tart or two along the way? The taco truck was there as well. We know, I think most of us do understand how improving diet and exercising can help prevent our entry into the sick care system, because we're going to end up there eventually, right? We are going to need to call upon the care that's available to us in the community at some point. And I say this to my beloved all the time. I mean, I love me some butter tarts. I love me a nice cold beer. What do you think I'm already thinking about after the show this afternoon on a beautiful day like this? The deck is calling, and so too is that beer fridge. And everything's okay in moderation. But you might remember at the beginning of this year, I set that modest goal of I'm going to touch my toes one of these days. Like, and people say if you do a little bit of stretching every day, you're going to get closer and closer to those toes. Well, how long do you think I kept that up? Like a couple of weeks, maybe. And now intermittently, I'll still do a little bit of stretching. Same thing where you get home from a day of work and you're feeling kind of tired. And you're like, do I really have the energy to exercise today? But if we start making the time for ourselves, because we know how valuable it is, how it pays off down the road, right? And this is where I get frustrated and I complain a lot to myself, to my poor beloved. I know what I should be doing. I'm just not very good at doing it. So if you're similar, you are not alone. The struggle is real, isn't it? Here's the real talk for you on the show this morning. I love doing this show every year. It's a nice check-in. It's a nice reminder. We all do the very best that we can. And if we can find a way just to do a little bit more, right? We know the recommendations are 30 minutes of physical activity each day. You can take weekends off, 150 minutes of physical activity per week. And that's got to be probably a brisk walk, not just the kind of walk you take with Rosie the pandemic pup. She walks at her pace. She goes on sniff-faries as opposed to walks. But we have to try to do these little things now to prevent our eventual entry into our sick care system. So if you struggle like I struggle, that's okay. We're going to keep working on it together because we're human beings and nobody's perfect, right? Last time I checked, not even Connor McDavid or Wayne Gretzky. That was the joke when I was a kid. Nobody's perfect except Wayne Gretzky. Wayne Gretzky's far from perfect these days in many people's eyes. Anyway, thought we'd share that part of this and talk more about the Prevent program that Jason Lemieux from Manulife was mentioning a moment ago. I know many of you get this. We talk about it enough so that we understand what we should be doing when it comes to taking care of ourselves and preventing or at least prolonging that eventual entry into the sick care system. The better we can do now, the more it pays off down the road. Don't beat yourself up if you didn't get your 30 minutes of exercise today. Just try to get that 30 minutes of exercise tomorrow. And eventually, it'll become that habit. And maybe, just maybe, I'll dial back the butter tarts this month after eating so many last month. I do my part, too. This is the Mike Farwell Show. We're on location this morning in Uptown Waterloo at the Public Square for RedDAY on 570 News Radio and Rogers TV. We are on location this morning in Uptown Waterloo at the Public Square. I think it's being debuted here on the show as we speak. Unless, was it? I don't think it was there when I got here this morning. I think the public water fountain is just finishing being installed. Hey, that reminds me, how's yours going, Cambridge? I think it's like a 5-year, is it going to be 5 years by the time it's done, from bringing it up first to council to actually having it unveiled when the work gets done down in Cambridge? But they are just putting I'm just looking the other way because I thought there was another one in the square. Anyway, I saw a big tarp earlier. I don't know if it needed some repair and it was covered up. I should be more observant when I'm on location. Nonetheless, the tarp is off, the water fountain, the water bottle filling station. Man, do you remember when you were a kid and there were water fountains everywhere, including in the schools, where you would always be just gulping drinks out of it? I used to put my mouth right down on the faucet and just let the water shoot right down your gullet and get your drink on. It was different back then, wasn't it? It probably, knowing more is a whole lot better. Probably not the best thing for us, but we've got it. We're testing it, and the crews are hard at work. There's also some folks, and I'm guessing, I couldn't quite see the sign. I thought it said CUPE, but I'll bet you it said Cup W. But there are dozens of folks marching along King Street here in Uptown Waterloo. I'm guessing, just based on the sign that I saw, that it is in support, of course, of our postal workers who remain in, can you call them negotiations? I don't really know, with Canada Post, but they're all wearing their reflective vests and their orange hats, and they've been going up and down King Street, just over to my right between William and Willis Way. And they are rallying in support of some labor union. I think it's got to be Cup W. It couldn't have, unless there's something going on with CUPE that I don't know about. It happens. It happens. But either way, they've been a bit of the entertainment here for us this morning as we celebrate Red Day and healthcare in our community. We're live on location at the Waterloo Uptown Public Square. Remember that you can support the efforts of our healthcare professionals by making a donation through RedDAY.ca. Donations being matched up to $200,000 by our friends at Manulife. We continue on the Mike Farwell Show this morning, 570 News Radio and Rogers TV. Indeed, it is Red Day. Do not forget to visit redday.ca with Manulife matching those donations dollar for dollar up to $200,000. Very pleased to be joined now by the Vice President of Innovation with the Waterloo Regional Health Network and the Chief Health Innovation Officer at the University of Waterloo. Danina Kapitanovich joins me across the table here at the Public Square. It's nice to see you in person. We've only talked before on the phone. Thanks for being here.
Thank you for having me, Mike, and great to meet you.
Danina, let's start with what innovation really does mean in a healthcare setting. It's a word that we hear an awful lot of, but how is Care Next helping redefine what that looks like in our region?
So, Mike, I'm sure for anyone who's engaged with the healthcare system, whether as a supporter or someone who was affected by a condition, it is quite obvious that the system is struggling to meet the growing demand, pointing to the fact that the business as usual is just not enough, which is why we must innovate. But as you pointed out, it is a word that is so often used that it's overused and it means different things to different people. Often people, when they say innovation, think a new shiny object or an app. But what it really is, it's about rethinking how we organize and deliver care so that it actually works better for patients, for clinicians, and for the system as a whole. So at RHN through Care Next, we define innovation as a collaborative process through which we effect practical change. It is not innovation if no one uses it, and it's not innovation if it doesn't bring value. What that means is working with frontline teams, with researchers, with patients, with community partners to solve real problems. Things like emergency department pressures, chronic disease management, care transitions, staff burnout. Innovation starts with the question, how could we rethink this so that it would work better for everyone involved? And Care Next was created to make that process easier, faster, and more connected. It's a shared platform between RHN and the University of Waterloo that supports innovation from idea to impact. We help teams surface problems, unmet needs. We help teams test and evaluate new models and build the capacity to do that work consistently across the region. So that what that might look like practically is that we might help a clinical team co-design a new care pathway, co-develop and adapt a new digital health solution, or support staff training and around change management and data use so that system innovation is rooted in everyday care.
We know, Danina, that Red Day donations help to fund the Prevent Clinic, which we've been talking a lot about. That's the unique program operating out of RHN. But why is it such a powerful example of what's possible when we approach care differently?
Thank you so much for asking that question. This is really an important notion that CareNext stands for. Our healthcare system, the way that it is designed, it's not really a healthcare system, it's a disease care system. We wait for you to get sick and then we intervene.
I've always called it sick care, and I don't mean that to be derogatory, but that's
what it is,
yeah.
right?
Yeah.
We seldom ever try to intervene before people get sick. And how wonderful would it be if the system as a whole invented a way to do that? Well, the Prevent Clinic is one of the most compelling examples of what it means to move from reactive to proactive care. It is a nurse-led clinic that identifies patients who are at high risk for developing heart conditions and then help intervenes before they end up in the emergency room or admitted to the hospital. What's unique is that Prevent doesn't sit in a silo. It is actually integrated into the broader system. So patients are referred from different places, from emergency departments, from primary care. They're flagged through data. And once they're in the clinic, they're given timely access to diagnostics, to coaching, to follow-up, to community connections and supports. The goal is to prevent escalation, but also to wrap care around the patient in a way that is accessible and human. From a system point of view, it's easing the demand, which we have said earlier is a big problem. But from a patient perspective, it's life-changing. And thanks to RedDAY and Manulife support, we're able not only to run this clinic, but evaluate its impact and share what we learn with others and look how to expand it to other areas.
Can you share with us how community partners such as Manulife or even maybe patients themselves, Danina, what role they play in making these kinds of innovations work?
Another favorite question of mine. Thank you for asking it. They play a foundational role. I'm a recent transplant in the region, but one thing that attracted me here and that resonates with me so deeply is the idea of barn raising. And at CareNext, we often describe our approach as a kind of a barn raising innovation model. Innovation doesn't happen in isolation. It takes many hands and a shared vision for what's possible. And Manulife's support for Prevent is a great example of that. They understand that investing in prevention isn't just about just good for patients, but it also makes economic sense, supports long-term system sustainability. But it goes beyond funding. We work with employers, community organizations, academic partners to co-create solutions that are grounded in local reality, in the local context. And patients are our core designers. We involve them early in the process, not just as end users, but as active contributors to how services are shaped. Their lived experience is often what is missing to unlock a better solution. And so when we talk about innovation, we're talking about a partnership across the board from institution to individuals.
I love barn raising. My uncle was the first ever barn raiser award winner here in the region, Danina. Danina Kapetanovich is with us, Vice President, Innovation, Waterloo Regional Health Network, and Chief Health Innovation Officer at the University of Waterloo. We continue the conversation live on location in Uptown Waterloo this morning on the Mike Farwell Show, 570 News Radio and Rogers TV. Live on location in Uptown Waterloo and continuing a conversation with Danina Kapetanovich, who is the Vice President Innovation with REN and the Chief Health Innovation Officer at the University of Waterloo. I mentioned earlier, Danina, CareNext, and you gave a great explanation of that. What is the CareNext Collective?
So CareNext conducts a number of activities, as I mentioned, in order to bring people together, to equip them, train them, support them through the process of innovation. Innovation really begins with knowledge. That's where it diffuses from. And so CareNext Collective is designed as a platform for two-way, really, knowledge sharing as well as sharing of best practices. It's a monthly virtual gathering that brings together clinicians, researchers, system leaders, and innovators, but it's really open to the wide community from across the Waterloo region and beyond. It's a space for peer-to-peer connection, idea sharing, and learning. The goal is to build this community of practice around innovation. We know that teams are doing incredible work across the system, but often in silos. And so the collective is designed to break down those silos and create a forum where people can share what they're working on, explore challenges, and learn from each other. So each session focuses on a specific topic. And for example, the very next one that we're holding at lunch hour noon on 27th of June virtually will feature the Prevent Clinic that we are talking about today as a case study. We will be talking to clinicians, we will be talking to Manulife, and we will be bringing patients who have gone through that program and hear their testimonials, seeking to learn how it came to life, what are the lessons we can carry forward into other areas of care. It really is a chance to see what innovation looks like on the ground and to invite others into the process.
What is it about the future of healthcare in this region, Danina, that excites you the most?
Oh my goodness. What excites me the most is the momentum, the shift in mindset. We are seeing a real cultural change where innovation is no longer seen as something extra, something you do on top of your job, experiment with and leave, but rather as an essential way to improve care and support our workforce. Through CareNext, we're helping to build structures, partnerships, capabilities needed to sustain that momentum, whether it's launching new train programs, building capacity to co-develop and adapt new technologies such as artificial intelligence. We're helping teams co-design better patient experience. We're embedding innovation into everyday life of the system. And this region is so uniquely positioned to lead. We have a world-class research and education at University of Waterloo, dedicated care teams across RHN, and a community that believes in doing things differently and doing it together. So we're building something that's not only locally impactful, but nationally significant, and that is incredibly energizing.
You know, we were talking during the commercial break about where we are at in healthcare in this community. With the new hospital about a decade away, this merger that has created RHN, the Waterloo Regional Health Network, and really, I think, Danina, and I'm taking my cue from you, but we have a real opportunity here, or perhaps we've already become this center in the province, maybe even this center in Canada that is doing healthcare a little bit differently, maybe can blaze some trails, raise some barns in healthcare.
Absolutely. Couldn't agree with you more. As I've shared with you before, we're uniquely positioned to create something that really is unique in the world, which is a partnership between a university that doesn't have a med school, which is typically the types of universities that partner with hospitals, but rather has a strong focus on science, technology, engineering, and math, and a local community hospital, which positions us to rethink how things are done. And I am not exaggerating when I say that we are poised to become an international example and a place that other regions can look to in trying to address some of the challenges that healthcare institutions in Canada, but really around the world, are facing.
What are those challenges that we are facing today?
So, there is a massive demographic shift happening in most of the developed world, wherein we are living longer, but aren't necessarily healthier. I heard someone say the other day, we are dying slower. And that paired with that system of care that waits for you to get sick to intervene ends up creating an enormous pressure. And as this demographic shift continues to grow, and as a number of seniors is exploding in our country, but a lot of the countries around the world, our systems are at risk of not being able to provide care for all of those seniors. So the solution isn't put more money in, because there's no more money to be put. Most of our provincial healthcare budgets are more than our provincial gross domestic product. And if we were to increase those budgets, then there's an opportunity cost. Then there's less for education, there's less for environment, there's less for infrastructure, and those are important too. So really the solution is we need to rethink how things are done. We need to innovate in the way that I have described. But as I said, with everything that we have here, the spirit of collaboration, the regional health network that is incredibly committed, and this world-class university that's known as Canada's Innovation University, that's known for thinking outside of the box, I believe we have all the elements to help the system reimagine itself.
It's very inspiring, and I think it gives us a lot to look forward to in the years ahead. Danina, thanks for being here today. It's nice to see you.
Thank you, Mike. Thank you for having me. Nice to see you too.
Danina Kapitanovich is the Vice President Innovation with the Waterloo Regional Health Network and Chief Health Innovation Officer at the University of Waterloo. Joins us here this morning on the Mike Farwell Show, 570 News Radio and Rogers TV. A beautiful day to be outdoors, a beautiful day to celebrate healthcare in our community. I have to be honest, it was validating to hear somebody as experienced as our last guest, Danina Kapitanovich from RHN and the University of Waterloo, to acknowledge, I mean, I've said this so many times over the years in these conversations with you, and I don't mean it in a demeaning, derogatory, insulting way. I'm not trying to pick on the system or anybody that works within it, because how many times have we said this over the years? We can have long wait times in ERs. We can have long wait times for a knee or a hip replacement, whatever the case may be within our healthcare system. But the people that work within it, once we are touched by them, we just get some of the best quality care you'll find anywhere on this planet. But do we have a health care system, or do we have a sick care system, or as Danina called it earlier, a disease treatment system? That's really where we're at, right? And I always go back to the old adage from our grandparents: an ounce of prevention is worth that proverbial pound of cure. And I don't think we do enough. I think the Prevent Clinic, which has been established thanks in part to the support of Manulife, which helps us stop smoking if we're still smoking, improve our diet and our exercise habits, managing health issues that might be related to or could lead to heart disease. Working on this prevention is so incredibly important, and I just don't think we do enough of it system-wide. So it was validating to hear that from Danina, and a good reminder for us, right? Especially when we consider the demographic shift that is underway, not just in this country, but worldwide. Again, we're living longer or dying slower, as Danina put it. And it's an interesting way to look at it. It's a great day for us to be outdoors, enjoying a beautiful Friday as we come into the late morning, about to head into afternoon. We're in the Uptown Waterloo Public Square, so it's a beehive of activity right now, and it's going to remain that way. Just got notice about an hour ago from the Uptown Waterloo BIA that there is going to be an outdoor Stanley Cup watch party here in Uptown on Monday, which will be, I guess, Game 3. I hope we're doing Game 2 tonight. My plan was to watch the game. I should pay attention to the next update and make sure if we're going to have a Stanley Cup game tonight. Anyway, you can watch it outdoors on Monday here in the Uptown Square. Everything is going to get underway at 7 o'clock. There's going to be cornhole. There's going to be a hardest shot challenge. This is a family-friendly rain or shine event. Come on, weather people. Give us some shine on Monday for the Stanley Cup watch party. And you can be right here in the public square and enjoy the game with your neighbors, which so many people are doing even here today. I mentioned it's a beehive of activity in the square, and I've talked to a number of people as they pass through, and they can't believe how active it is and how much they enjoy coming here because they do a pretty good job. So to our friends JS and the rest at the Uptown Waterloo BIA, the programming that happens here in the square, it is a very well used square, and it is programmed well to have that sense of vibrancy that you want to have in an uptown core. And speaking of, look at that, there's JS on the other side of the street. He's actually out with a garbage bag, and he is picking up garbage himself. You know what that reminds me of? That reminds me of, what a guy. That reminds me of Dom Cardillo. Do you remember that too? Dom Cardillo, the former mayor of Kitchener, was famous for two things. One is pens. Always was giving out a pen. The other, you would see the man stop on the streets in downtown Kitchener or wherever and pick up garbage along the way. That's the kind of mayor that Dom Cardillo was. From the Uptown Waterloo Square where I am today to Carl Zare Square in downtown Kitchener on Sunday, and really throughout the downtown. I think we're going to go from about Water Street down to Ontario or some such thing. Either way, it's Eric Traplin Day in Kitchener, and that's going to be great. Noon until 5. Family fun all day long. Eric will be on stage at 1, not necessarily to perform, but to be celebrated. So we want to celebrate one of the region's best known entertainers, and we'll do that in Kitchener. So the core of Kitchener will be active and activated on Sunday as well for Eric Traplin Day. Noon until 5, downtown Kitchener comes alive with that celebration. And of course, from Cambridge, North Dumfries, Woolwich, and Wellesley, you're all invited because Eric has performed for all of us or all of our kids at one point. This is the Mike Farwell Show. Well, you don't have to take it from me. Even our guests, every time they sit down, comment on how beautiful a day it is to be outdoors, which is where we are in the Uptown Waterloo Public Square. And as we continue our Red Day conversations, pleased to be joined by Al Kawash, who's the Director of Clinical Care and Cardiac Care at REN. Al, good morning. Good afternoon now. We've just changed the clock.
Yes, good afternoon, Mike. Thanks for having me.
An absolute pleasure. And Sarah Beingessner is with us as well, nurse practitioner at REN. Sarah, good afternoon. Nice to see you as well.
Thank you. You too.
You've got the glasses to match the red shirt. You're all redded out today.
I am. I'm ready.
Al, let's start with you if we can and talk more about the Prevent Clinic at REN, which we've been mentioning throughout the day here. Why is it such an important program for our community?
You know, our community suffers from some significant issues. One particularly being the lack of patient or family doctors to patients. So unattached, we call them unattached patients. So these patients do not have a family doctor where they go, and so Prevent kind of fills that void when it comes to cardiovascular care. And so, for example, if a patient went to the ED and they were unattached, they would be referred to us so that we can see that patient and screen them for diabetes, high cholesterol, high blood pressure, to be able to help these folks get ahead of the situation before it gets worse, because as you know, high blood pressure is the silent killer, and we want to make sure that our community is healthy, because a healthy community is a prosperous community, and this is one way of doing it. And as a hospital, now that we are Waterloo Regional Health Network, it's in the name, network. Our job is to network with the community and making sure that the community understands what cardiovascular health looks like, as well as being involved and partnering with community partners so that we get the message out there to our priority neighborhoods. As you know, Kitchener-Waterloo is a booming center with a primarily large immigrant population. We want to make sure that they understand, their cardiovascular health is very important. And we're breaking down barriers. We're going out to the community. We're putting these clinics in, meeting them where they are, as opposed to them coming to us. So that's the beauty part of it.
Sarah, can you walk us through the patient journey when they go through the Prevent program? What does it look like, and what do you hope to discover or help those patients work through?
So for patients who have 2 or more cardiac risk factors, so high blood pressure, high cholesterol, they're diabetic, they have a strong family history of having a heart attack or stroke at a younger age, or are current smokers, they can be referred. And really the research says that the more risk factors a patient has, the higher the risk they have of having a heart attack or stroke in the future. And we have some fairly accurate risk tools to be able to determine in the next 10 years, what is the percentage chance that you may have a heart attack or stroke. And we use that in the Prevent Clinic to discuss treatment options with patients. So the intake process, Mike, the first appointment is with a nurse practitioner. So we complete a cardiac risk assessment and develop a plan of care for the patient. We have the opportunity in this first appointment to spend up to an hour providing education, as well as nurse practitioners within our scope, extended scope from registered nurses, have the ability to change and optimize medications, order blood tests and other testing that we think is appropriate, and make referrals to other specialists. And our nurse practitioners in the Prevent Clinic, the two of us have 25, 30 plus years of experience working with patients who have heart disease. They've had bypasses or angioplasties. They're dealing with and struggling with, heart failure. And so we find this really rewarding, being able to help people before they have an event and incur damage to their heart and prevent that from happening.
We've been talking about the Prevent program quite a bit through the show today. Let's talk about results, and I'll start with you. What are we seeing from some early results, stories, feedback from patients and staff?
Yeah, and so part of our partnerships have really shown us some great successes. We've been able to lower a lot of folks' cholesterol, get their blood pressure under control, get the glucose under control. We've heard testimonials from patients, particularly in our immigrant community. It is nice to have someone to speak their language and making them understand the cardiovascular risk factors. And so that has been one big positive thing. And it spreads, right? They talk, they tell their friends, and they're unattached as well in those priority neighborhoods. And we see them and we treat them. And so thus far, we've seen over 200 patients and about 400 unique encounters to treat these folks. And it's not just cardiovascular health, it's the whole person. When we look at patients, it's not just their heart, but patients come with other challenges as well that we have to address. We have a remarkable staff in our nurse practitioners, our physicians, our nurses, who are very knowledgeable and can deliver that care that we want into the community.
Sarah, what are you hearing so far by way of impact of the Prevent program?
We, as Al mentioned, go out to the community, and we developed a satellite clinic actually at the Kitchener Downtown Community Health Center, which is now called Health Caring KW. And we have a nurse practitioner there primarily to see patients who are unattached, newcomers or refugees who really have had no preventative care, some of them not in their life at all. And they are just so thrilled that someone actually sits down and takes the time. There's a really neat translating service we use. So even certain dialects, we're able to translate and spend the time, because some of these appointments take a long time with translation. And so, patients are so happy that they can not only see the nurse practitioner, but they have access to our registered dietitians, our kinesiologists, our respiratory therapists if they want to quit smoking, our social worker, and this is all free of charge. We have a relationship too with the YMCA, so if people want to continue with their exercise program, they can get a reduced membership at the Y. So I think so far we're seeing some great results, and we just really hope we can continue.
Sarah Bein-Gessner is a nurse practitioner at the Waterloo Regional Health Network. Al Kawash is the director of the Clinical Care and Cardiac Care Center, Waterloo Regional Health Network. We continue our conversation on this Red Day here on the Mike Farwell Show, 570 News Radio and Rogers TV. We continue our conversation with Al Kawash, Director, Clinical Care and Cardiac Care at RHN, the Waterloo Regional Health Network, and Sarah Bein-Gessner, who is a nurse practitioner. I mentioned earlier, Al, we've been talking about the Prevent program a lot through the day, and we've been talking a lot about RHN, the Waterloo Regional Health Network, that network word that you emphasized earlier. But what makes RHN, the hospital, well positioned to operate or even expand this Prevent clinic?
I would say, as you alluded to and what I said earlier about the network, us being a network, my vision of cardiac care and critical care is that we are the hub, and we're going into the community so that they understand, because we have the expertise. We have, as I said, the nurse practitioners, the physicians, the nurses. We have the connections to reach out to the community and the ability to reach out to the community to deliver that care, that preventative message, not only just to adults, but to the kids, to the schools, so that we are a healthy community. Again, a healthy community is a prosperous community. And so the hospital right now is in a great position to be that leader in that community. They're looking for that leader. We are that leader, and we will continue to be that leader.
Sarah, where can people learn more about Prevent Clinic?
Yeah, so if you Google Prevent Clinic, the first or second link that comes up, and there's all information on the website. The phone number is 226-806-5911. We also have an email address there. People can always reach out and see if they qualify. They do need a referral from a family physician, nurse practitioner, or a specialist at this point in time.
Are you operating out of the building on the boardwalk, the medical building there?
You got it,
yeah.
Absolutely. Medical building 2 up on Ira Needles. Yep.
Yeah. We talked earlier about the journey that a patient goes through when they arrive at the clinic. I'm guessing, Sarah, that this runs across demographics, age, gender, etc.
Absolutely. Yeah, absolutely. We run the Prevent Clinic actually out of our cardiac rehab facility. So all of our health professionals have years of experience managing people after events. So we're using, their expertise to help these people before. And so, yeah, we see quite young people. I've had, and this was ultimately the reason why Dr. Heather Warren, pitched this to the foundation, is she was seeing more and more young people coming into emergency departments with heart attacks who had risk factors that hadn't been addressed, primarily because they're unattached or newcomers to the community. So, that's where we're at.
It's a perfect name for it.
Yeah.
Prevent, for that very reason,
exactly.
right? Are either of you, are you used to the RHN yet? Because we've talked before, and we had, I'm not even going to go back to the old names because we want to get people used to the new ones. Are you used to RHN?
Yeah, I'm getting there. Sometimes it slips out that I'll say our legacy hospital's name, but it's coming. It's coming.
Yeah.
It's 1 versus 3 syllables, and I just love the logo with the bird.
Yeah.
I think it's great.
Yeah, absolutely. And it's pretty exciting, isn't it, Al, at this time, like to think of this merger and what it means for healthcare in our community?
Absolutely. We have a real opportunity here. Prevent is that opportunity as well. One of many opportunities. My focus is cardiac care and critical care, but we have a big opportunity here. And with partners like Manulife, the sky's the limit. Mm-hmm. We are aligned in where we want to see this community be healthy.
You talk about that partnership with Manulife, which makes me think about the $200,000 matching donations today, this being RedDAY. How exciting a day is this for you folks that work in the hospital setting?
It's amazing. You see everybody wearing red shirts. Everybody's excited. Now with our merger with the Legacy at Midtown, they're excited now too, because now they're learning about RedDAY and what it means to this community.
Sarah, what about you?
Mm-hmm. I was just at the hospital this morning discharging some patients, and there's competitions, every unit on the door, the RedDAY competition. Yeah, it's great.
Yeah. It's not so bad getting out of the hospital setting, though, for a beautiful day like this in the public square.
I know.
Absolutely.
And a lot of activity. I think there's exercise actually happening over there.
Yes.
Looks pretty good. Al, Sarah, thank you both very much for making time in your busy days, and keep up the great work at RHN.
Thank you. Thank you.
Al Kawash joining us, Director, Clinical Care and Cardiac Care with the Waterloo Regional Health Network, and Sarah Bein-Gessner, who's a nurse practitioner at RHN. This is the Mike Farwell Show. We're on location in Uptown Waterloo at the Public Square for RedDAY on 570 News Radio and Rogers TV. It is indeed RedDAY, first Friday of June. This has become the stuff of tradition in the region. I certainly enjoy it. In fact, every other time we've been in the lobby of the RHN at Queens Boulevard. You see what I did there? I used the new name, not the legacy name, as Al Kawash so appropriately put it in our last conversation. We're going to do a quiz for you at the end of the show to make sure we are all up to snuff with our new names, okay? It is no longer Grand River Hospital or even KW Hospital if you're old like me. It is RHN at Midtown. It is no longer St. Mary's Hospital. It is RHN at Queens Boulevard. And it is no longer Freeport, but it is RHN at Chicopee. And, of course, the Waterloo Regional Health Network, which we shorten to RHN, is part of a merger that happened, approved by our Ministry of Health back on April the 1st. And this is the organization now and the healthcare entity in our community that will lead us into the construction of that new acute care hospital up off Behringer Road in the David Johnston Research and Tech Park at the University of Waterloo. We're on pace. Everybody says that we're still going to aim for, and we're working towards that deadline of a decade from now. Give it about 2035, and that new acute care facility should be opened. Speaking of the Research and Tech Park, again, a thanks to Mike Pereira and the team there for hosting a nice outdoor, what a way to spend an afternoon, beer garden yesterday in support of Farwell for Hire. It was great to catch up with Mike and the team, spend some time with the folks working up in that Research and Tech Park. A lot of interesting things going on. And hey, who wouldn't want to enjoy a cold beverage and some good food? They had a food truck pulled up as well on a Thursday afternoon. I'll remind you one more food-related event before we finish Farwell for Hire fundraising this year, and that's going to be on Father's Day. June the 15th, we're going to be at Barry's Asparagus along with the Schmuck Truck for some deep-fried asparagus. You're going to love it, I promise. Keep your eyes on our Facebook page, our Farwell for Hire Facebook page, if you will, and you'll keep up to date with all of the details around that. But June the 15th at Barry's, follow Farwell for Hire. That's Farwell, the number 4, Hire on Facebook. Other news of the day, I saw Regional Councillor Jim Erb walk through the public square earlier today, stopped to say hi, and I'm just thinking about the Urban Good Funeral Home, which of course is on King Street South. I think we're south by the time you get to the Urban Good, but they are relocating, as you may know by now, over to Victoria Street in Kitchener, where the Home Hardware used to be. So kind of in between, let's call it McDonald's and Canadian Tire. I think, no, McDonald's, I'm down too far. Tim Hortons and Canadian Tire. Anyway, on Victoria Street, not far from River Road. I think you know the spot I'm talking about, on Victoria, where the Home Hardware had been. That's going to be the new location for Urban Good Funeral Home. And they would like to have, along with that funeral home on Victoria Street, a crematorium. You may already know that the Henry Walzer Funeral Home, not all that far away from what will become Urban Good on Victoria, but the Henry Walzer Funeral Home on Frederick by Edna has also been approved for not just the expansion that's underway, but a crematorium, which begs the question, of course, how many crematoriums is enough crematoriums for one Kitchener neighborhood? I have learned a little bit about the process of cremation, and although it may make you feel uneasy and you'd think this is kind of an uncomfortable thing to have in one's backyard, so to speak, it's actually quite impressive the way that the work is done, and it's going to be an interesting decision for Kitchener Council to make, I guess, when it comes to the zoning for 2 crematoriums in such a small geographic area in the city. But nonetheless, when I saw that headline this morning and I saw Jim Erb, I thought that's worth a mention. How many crematoriums is enough crematoriums for one neighborhood in Kitchener? I guess we'll find out in the months ahead as Kitchener Council works with that decision. We are on location in the Uptown Waterloo Public Square for Red Day here on the Mike Farwell Show, 570 News Radio. A reminder that Manulife matches donations today up to $200,000. Make your donation at RedDAY.ca. We've talked so much about what happens within our healthcare setting, why, what we've been able to accomplish over the years, thanks in large part to the partnership with Manulife. But now we're going to get the chance to hear, and these are my favorite stories to share, from somebody who has gone through the program in the past. Lisa Schneider is a cardiac patient treated at RHN at Queens Boulevard, of course, formerly the legacy name St. Mary's General Hospital. And I'm just going to be honest, an old friend. It's nice to see you. Thanks for stopping by.
Nice to see you as well. Thank you for having me.
We actually have done this before on one of our previous Red Days, but many, many years ago. So you just mentioned during that news update with Matt that it's your 15-year anniversary. So you thought, let's come back and talk about the story again.
Yep, got to share the stories and get the information out and hopefully help other people to realize that there's prevention available.
Absolutely. So let's talk about the care that you did receive when you received it, Lisa. How did it come about? What was your journey into our system?
Well, a few months prior to my event, I had some symptoms that I ignored for, as I said, a while. And then the day of the event, it was overwhelming heart pressure. The pain went up into my jaw and down my arm, and that's when I knew I had a problem. Thankfully, I had a friend with me who was insistent on calling an ambulance, and they got me to St. Mary's at the time. And in the full heart attack event, they saved my life.
Incredible. And you talk about those symptoms that you ignored, such as?
Well, I volunteered for KW Oktoberfest at the time, so I thought my journal was too tight or I had too much schnitzel, so it was indigestion, and there was a bit of heart pain, but I thought I was just rushing around. And and I think like most mainly females, we tend to ignore things and look after other people.
Yes, you do, indeed. So I mentioned this is 15 years for you now. What does this milestone mean to you, Lisa?
It's incredible. I mean, I'm grateful every day to take another breath and put my feet on the ground. And my nieces and nephews have now gotten married and they have their own children, so I got to be witness to all that and enjoying life with my family and friends.
What was it like when you talked about those symptoms that you ignored, and then thanks to the friend that got you to the hospital the day of I find it interesting too, the event. Is that
cardiac event?
No, I know, but I just wonder if that language is something that you just grow accustomed to, or, right?
Yeah, I use more colorful language when I talk about it myself, but yeah.
So what was it like for you then from the moment of entry into the system, the day of that event?
It was overwhelming because it takes time to diagnose a cardiac heart attack, and you have to take blood work a couple times. So there was a few hours in between, and I'm like, somebody's got to do something. And then it got really bad.
Did you know you were having a heart attack at that point?
No. I thought, what the heck?
Right. Bad case of indigestion or whatever.
Yeah. But then the symptoms got increasingly worse, and I said to my boyfriend, somebody better do something or I'm going to do something. So it was just, the pain got so unbearable, and that's when things started to move. That's when they realized, oh yeah, she is having a heart attack. And they told me, and I looked at my boyfriend and I said, did they just said I'm having a bleeping heart attack? So yeah.
And you were having a bleeping heart attack. What have the 15 years since been like for you, Lisa?
Like I said, wonderful. My health is well, and I take, I do my exercise and try and eat well, like we all do. Try not to have so many butter tarts.
I had, it was a mini one I had this morning, okay? Just a mini.
Yeah.
Yeah.
So yeah, try to spread the word, and as I said, I'm most grateful for seeing my nieces and nephews get married and them now having children that I get to enjoy as I call them my littles. So.
When it came to post-cardiac care, what was that like for you? Like, how long did it take to start feeling like you did beforehand, if you ever have?
I was in ICU for a while because I had a complication afterwards, and I got home and I was scared. I was scared to cough or sneeze, or because I thought, like, what's going to happen? But once I started at cardiac rehab, I think it was a 2-month program at the time, then I started to feel more confident in my abilities, being able to get on the treadmill and getting back to normal life.
So when you got back to normal life, like, what does that look like? And how nervous were you to go back to normal life, off a onto a treadmill, onto an exercise bike? You must have, I'm guessing, in the back of your mind, been thinking about this ticker and how it was going to hold up.
Absolutely.
Yeah.
Yeah, and even going back to work, it happened in November, and I went back to work in January, and even that was a I was fearful of that as well. Getting overwhelmed, and sometimes initially you think, is this going to happen again? When is it going to happen again? But I don't think that way anymore. Just one day at a time.
Yeah. Was there a point at which you remember, Lisa, that, okay, I'm not going to dwell on that, I'm not going to think about that?
It took a full year.
Yeah,
I
I'll
think
bet.
after my 1 year anniversary, then it was like I can't live in fear anymore. So I just have to get on with it and enjoy my days.
Yeah. And once you got to that point in hospital the day of the event, and it was, okay, did they just say I'm having a bleeping heart attack? What happened from there? What was the care like?
Well, they realized I was having a bleeping heart attack, and it was like a scene out of Grey's Anatomy. I was on the stretcher, and there were nurses beside me, and my family holding my hands, and you could just see the lights up, the fluorescent lights up above passing you. And we get on the elevator, and me and my family still to this day call it the Holy Bleep elevator, because I swear it moves faster than any elevator ever, going up to the cath lab. And then I got into the cath lab, and I was awake for the entire procedure. I had 2 stents put in. And as soon as they put the first stent in, I could feel the pressure release. And then they put the second one in, and everything felt wonderful.
Incredible.
Yep.
Just like that. I mean, it sounds almost miraculous.
Yeah, but, they open up the artery so the blood can flow through. Then you get more oxygen, and there's no pain, and... yeah, it's incredible. It's incredible what they can do.
Yeah. Lisa Schneider is a patient now 15 years removed from her cardiac event. Yeah, the woman had a heart attack, and she's here to tell us about it as we continue our conversation on this Red Day in Uptown Waterloo. This is the Mike Farwell Show, 570 News Radio and Rogers TV.